day to everybody. The session 2 is called Technology and Pensions, and we will have 3 speakers here. The first is Tom Baker, who will be talking about regulatory challenges for robo-advice. Tom is the William Mole Mise Professor at Pennsylvania Law School and has also a position at Wharton School, Healthcare Management and Business Economics and Public Policy Department. He's been doing research in insurance, but he's also a practitioner, because what I can learn from his bio is that he's a co-founder of Pickwell, which is a health data analytics company that is using also robo-advisors. He has BA and GD from Harvard University. Then we will have an intervention from Marike Knoef from Leiden University. She's professor of empirical microeconomics there, and she's also a board member of the Network for Studies on Pensions, Aging and Retirement, Netspar, which is a very active part of this association. She's been doing the research mainly, I think her focus is retirement savings adequacy and the communication of pensions. And finally, we will listen to Cosmin Munteanu, who's assistant professor at the Institute for Communication, Culture, Information and Technology at University of Toronto. And he's also a co-director of the Technologies for Aging Gracefully. That's a very nice name, at the University of Toronto. And he's specializing in the intersection of human-computer interaction, automatic speech recognition and natural user interfaces, and also mobile computing ethics and assistive technologies. That's a quite impressive number of fields. He'll be talking about designing for elder adults, overcoming barriers to supportive, safe and healthy retirement. So without any further delay, I would like to give floor to Tom. Thank you.
Great, well, thank you. So I'm going to share my screen. Let me know if it works. Yes. First of all, I'm a law professor, so I do more conceptual work. Sometimes I will do the kind of empirical work that is being presented here, but this is not an example of that. So, and the thinking on this that I'm going to be talking about is work that I've done with Benedict Dellert, who's also, I understand, active in Netspar. So it's very much, we've been thinking through this together. So I first wanted just a little bit of ground clearing of really what is a robo-advisor. And, you know, we had been thinking about robo-advisors as principally being the investment companies that people may have heard about, Betterment, Wealthfront, that kind of company. But when we look out in the world and how the term is used, there's really kind of 2 ways that we see it used, and sometimes these are together. One is that where you know, a robo-advisor is not necessarily the behind the scenes tool that's doing the kind of work of deciding what the right financial product is, but the interface, and that's, you know, more like a robo in terms of like a robot that people are developing it. And so I've just, you know, got some pictures of you know, both of these kinds of things so people can see. And so the interface these days are, most of them are really software wizards, which is just a fixed sequence of dialogues. They aspire to being chatbots, and sometimes they, you know, for marketing purposes, companies will say we have a chatbot, but really it's a software wizard. And so one of my favorite ones is there's a company called Lemonade, which people may have heard of, which is very interesting new insurance company. And they talk about how they have chatbots, but the chatbots are actually just, you know, cute little wizards that allow you to either, you know, apply for insurance or to make a claim. But you know, there is a sense in which there's something different and believed to be, in Lemonade's case, appealing to young people about dealing with this, you know, artificial person rather than a real person. So that's one sort of side of robo-advisors, and then the one that I think people have mostly thought about, and that frankly, Benedict and I had done the most thinking about when we did the paper that I think led us to be asked to talk about it, is the companies that use some kind of user model and algorithm and data to generate recommendations. And so you see that in the insurance space, you see that in the financial loans, home loans, mortgage rates, credit cards. And then, in retirement, I would say these are, most developed for retirement savings products, but also the kind of the cutting edge health care products are. And then I will confess, there's a little picture of Pickwell, which is my company, and is in regards to retirement health products. And in part, that's because the data are available. One of the things that I'll be talking about is a regulatory challenge, is that in order to build a good tool, you need to have high quality information about the products. And because the products are to the extent products are privately provided, and there's not a mandate that the details of them be available in machine readable form, it's difficult to build a good tool. And so the reason that the best health insurance tools in the US anyway are in the Medicare space and in the new kind of Obamacare exchanges space has to do with the fact that the high quality information about the plans is available in machine readable form. And then this is a picture of Wealthfront, which is my favorite, not from a quality perspective, but sort of from their design thinking perspective of the investment robo-advisors. And and you could see from this picture that that the appeal, different companies have different appeals. That Lemonade, its appeal is we're kind of cute and easy. The Wealthfront appeal is that we're really smart and you can trust us. And thinking about these tools in a kind of conceptual way, we just thought about them, and this is experience both from practical of building Pickwell, but then also thinking conceptually with Benedict, that there's really several different parts of it that raise different regulatory issues that I'll talk about in a moment. So that at the end of the day, what a tool that's helping you pick the right thing is doing is it's taking attributes it knows about you, and attributes it knows about the product, and then it's building a model. It has a model about how to best match that and make recommendations, and then it presents those to you in an environment that I assume most people in this group have heard of the term of choice architecture, which is really just developed by people in both the judgment and decision-making world in psychology and behavioral economics and economics, of talking about really in a thoughtful way, realizing that the decision environment affects how people make decisions. And so those are, and that, again, this really kind of simple picture is what's behind our regulatory considerations that we're going to talk about next. And so we are trying to answer questions about what the first set of questions is, what's the role of government in, making sure that the quality is good, and, making data available to facilitate. And then I would say we didn't, in the papers that we've written so far, we haven't thought adequately about this last question of really promoting values such as autonomy. Personally, I've been quite influenced by the work that kind of got summarized in Shoshana Zuboff's book, Surveillance Capitalism, which, although is as extreme and exaggerated, raises really profound questions. And there's one such question is, do we want to be promoting autonomy through these choices so that we're have a world in which people are not simply surrendering their choices to experts in a way that could lead to problems of a more global scale. And then, and around the corner question that I, is just, it's around the corner because we don't know yet because people don't yet have access to and take advantage of good quality robo-advice. But that if that were the case, then we would be living in a world in which people would be sophisticated choosers in a way that we all know that ordinary people are not. And if people could be regarded as sophisticated choosers, what would, there might be different, certainly in my area, which I know best, which is insurance, I think there would be some quite significant consequences in terms of the role of government and sort of limiting the choices available to people would be, and for paternalistic reasons, I think would be reduced if we thought that people all had access to and took advantage of good robo-advice. So, the positive side of robo-advisors, in theory, they're really amazing, right? They're available 24/7. I mean, my children who are older than I like to admit, but a lot younger than me, can't ever believe that something's not available at 3 in.the morning just because that's when they want to do it. And of course, machines are always available. They're as long as they're programmed properly, they're always competent, and they don't have the paradox of choice. And they can, depending again on how they're programmed, they're not biased, and they can be transparent in the sense. And I would say so far, robo-advisors are not, the robo-advisors that exist in the world today are not principally taking advantage of the kinds of machine learning technologies that lead to concerns about transparency, sort of black box sort of things. At the moment, they're more of the traditional kind of program. You can see what they do if you know how to do that. And then of course, they're amazingly scalable that, and in fact, there's a really wonderful paper out by an economist making the argument that there's antitrust concerns raised by robo-advisors, since as the marginal cost approaches zero, there's potential for reduction of competition, and perhaps the problem of 12 that people were talking about earlier might be an example of that. And so we just have on this one slide really an overview of what we think the different regulatory concerns are that relate to the different components of robo-advisor. And I would say the main work that we did in our paper was just to kind of separate out these components. And you need the algorithms and the user models, and the regulatory concerns are that are they biased? Do they work? There's an increasing concern in computer science circles about the fairness of algorithms, and then there's a concern about scale, which is that of course one of the nice things about everyone going to their individual financial advisor who's a person is they might often be wrong, but hopefully they won't all be wrong in the same direction. Whereas of course, if everyone was doing everything through the same model, models we know are never perfect, and terrible to be all wrong in the same direction all at the same time. With data, the regulatory concerns are about making sure that there's availability. Again, as I mentioned, in the US, good quality robo-advisors exist for investment products. Why? In part because all the data for investment products about the attributes are available through the SEC, and good quality robo-advisors exist for health insurance choice only in relation to those health products for which the data about the attributes are available. And then there's also consumer have different attributes, and if you're going to be matching and recommending, you need to know about which ones are important. And there's there's questions about getting good access to that as well. You may need information about consumers that they themselves don't know. And then there's a choice architecture aspect of there's a concern that it's presented in a way, it can be, let's put it this way, you could have a wonderful user model that recommends all the right things, but it could be presented in a way that introduces the bias that is not present in the user model and the algorithms. And then the final concern, which we don't really have any particular competence to talk about, but is quite important in my sense as regulators are quite focused on, is the whole IT infrastructure issues. And then a kind of provocative question that we raise and don't really answer, and I just would be, should there be a license for robo-advice software that the human intermediaries who provide consumers with information about financial products have to have licenses. You know, right now the model is that the robo-advise company has people working in it who have the license, but they got the license by taking the same, you know, 4-week cram course that everyone else does. And, you know, that's not quite really what's going on. And, you know, a question is what would a license for robo-advice software look like?
2 minutes.
And then just to kind of, okay, great. And so I'll put the slide up. We have a series of questions that we think regulators ought to be asking about algorithms and models. The big one for the is what's the model maximizing, and what are you doing to make sure that you are learning as you're going. Questions about data, you know, where does the, you know, where are you getting the data from? What data do you not have access to? How do you check the quality of your data? Questions about choice architecture at this point are, I would say, really wanting, you know, there's not enough science of choice architecture that we can be guided by more than kind of best practices at this point. But you know, the big question that I would say we would want to see is really the bottom two, which is, you know, when someone chooses, when people are regularly choosing things that are different from the recommendations, you know, how are you learning from that? Does that mean that your choice architecture is biasing them, or is that feedback on the quality of the user model? And then finally, you know, do you promote autonomy and how? And then question that, you know, again, around the corner is, if people really go in the direction of robo-advisors, you know, how do we promote diversity and quality among them? And, you know, what can we use, you know, how might we use what we learned from robo-advisors to, you know, perform better regulation of humans? Can we use the robo-advisors as a benchmark for humans and so forth? So with that, I will stop.
Thank you very much for this insightful presentation. I'm sure that the IOPS members, they're very happy about having the list of the questions. It would be even better to have the list of the answers, but for the time being, it's good to have these questions.
Yeah, exactly. Yeah, well, law professors are much better at asking questions than providing answers.
Well, but that's the half of the success, if we know what we should ask. Now I would like to ask Marike to share the screen and start her presentation.
Yes, so thank you very much. Also for organizing this conference, because even if it's online or online, it's still nice to see you and to discuss these kind of topics. So this presentation is about raising pension awareness. And yeah, maybe we think, why should we care about that? So now we have a lot of pension system reforms. So that's all with the goal to increase the financial sustainability of pensions. But in addition to this financial sustainability, also the social sustainability is very important. And so that people understand the system, that they accept the system, that we don't have all kind of protests. And a key issue in this is the pension communication. And there is this presentation about. So some years ago, we got new neighbors. It was a young couple. And I thought, oh, I will send them a note in the regular mailbox, like, now welcome to this new apartment, and maybe we can have a drink together. Now, and then it took some time before I got a reaction from them. And I thought maybe they don't like neighbors, yeah, could be. But after all, it appeared that they did like neighbors, but they were not looking in their mailbox so often. So it's only like once in 2 weeks that they check their regular mailbox. And they much more often checked their social media accounts. So that was also something that I thought, oh, maybe also in pension communication, yeah, we need more modern types of channels instead of just the regular mail to inform people about their pensions. Now, I thought let's have a look at around the world. It's just not just the Netherlands. What is the social media use around the world? So here we see the total population is about 7.75 billion of people. 4.54 of them are using the internet, and 3.8 billion are active social media users. So it's more than I expected, I have to say. So that means it's like 49% of the population, and it's also increasing very much. Now, this 49% that are also babies included, which who are not on the internet, of course. So let's also have a look at US adults. And here we see several groups of US adults, and we see that it's about 75% of them using Facebook. And it's somewhat higher among the young age groups and somewhat lower among the people who are having a pension. That's about 50%. Now you can be a Facebook user, but then yeah, it also counts like how much time do you spend on this Facebook. So I think we have also a poll question on this, if it works. So what do you think is the average daily time spent on Facebook by users in the US? Let's see whether there's also somebody answers. Dariusz, can you see the answers, or Hazel?
I can only know what I asked, what I answered. I can't see the answers.
No, me neither. No, it doesn't matter. It's not so important. But now, if you want to know,
but my lucky guess was 60 minutes
here.
or more.
Yeah.
Oh, we have the results.
I see. Yes, we have the results. Thank you. So it's indeed, it's a lot of people amongst you say it's more than 60 minutes. Now, it's a little bit less on average. It's like 37, 38 minutes. So in this group, but still that is that's substantial, and so substantial that we can, yeah, it would be interesting to know, is this a good channel to inform people about their pensions? And maybe also at least the young people, to inform them. Now, the figures are similar for the Netherlands. So here we see in 2020, it's also about 75% of the adults using social media and using Facebook. And this is larger, although there was a decline, also maybe because of some privacy issues related to Facebook. But still, it is the largest channel compared to, for example, Instagram or Twitter. So therefore, in this research, we did an experiment using the Facebook channel, because it is an important channel where a lot of people are using this channel. And what we wanted to investigate is what is the effect of mail and social media on pension awareness. And then the question, of course, is also, yeah, what is pension awareness? So we think it's about two things. So first, it's about financial literacy. So do I have a general understanding of the system? And secondly, it's about insight in my personal financial situation, which is also important when I want to have to make choices about savings and so on. Then I need to know more about my personal situation. Now, how are we measuring this? So we have, for financial literacy, we made 5 basic questions about the pension system. And with regard to personal financial situation, we asked people to do the pension check. That is logging into a website in the Netherlands where you can see how much pension you have accumulated. Now we have an experimental setup, so we have 8,000 people, and half of them, 4,000, received a letter. And in this letter we have some general information about the pension system in such a way that they would be able to answer these 5 basic questions. And we asked them to go to the pension check, to the national website, to log in to see their own personal situation. And the other half of the group, they didn't receive the letter. And then we also had a Facebook ad. So we had an ad on the Facebook channel. And we also provided people with the basic information about the pension system. And we asked them to go to the national website to check their personal situation. And then 6 weeks later, we sent a survey to this whole group of people. And we wanted to know, after 6 weeks, those who received the letter, did they answer these basic questions better than those who didn't receive the letter? And those who saw the Facebook ad, did they also have more pension literacy? So did they answer these questions better? And also did they more often go to this personal website? Now, of course, Facebook is not, we could not randomize this as we can do with a letter, but we did a quasi-experiment where we used being a Facebook member as an instrument. So to also have causal effects both with the letters and with the Facebook use. Now, what do we find? We find that the letter is twice as effective as Facebook to increase pension literacy. So apparently a letter is better, people read it better than when they see an ad on Facebook. But Facebook is 3 times as effective as a letter to increase the pension check. So it's much more easy when you are on Facebook to click through a website instead of when you have a letter and it's like, hey, you have to go to this and this website, and then you have to take another device to go to this website. And then the hurdle to go to the website is much larger. Now, we also did a cost-benefit analysis. So the letter, we found it is, people read it better than Facebook. So it has a larger effect on these, answering these questions in the right way. But a letter is also much more expensive. So then when we do a cost-benefit analysis, we see that for one additional question right, of these 5 basic questions, we see that we have to send letters for about 4.35 euros before getting one additional question right. And that is much lower for Facebook. So there, this is only 5.6 euro cents. And of course, this is even more when we look at the pension check, because it's very easy for Facebook users to go to the website. So we see for the letter, we have to send letters up to almost 16 euros before we get an additional pension check. And for Facebook, this is only 2.5 euro cents. So that brings me to the conclusion. So what we see is that social media use is large and it's growing. So therefore, it's interesting to see, like, is this a channel that can be used also to make people more pension aware? We see that people read letters better than ads on Facebook. However, a Facebook ad is more effective in attracting people to a website. And especially, I saw in the Netherlands, we have a pension fund of cleaners. So it's a low literate group. And their letters are always difficult. So they are more using videos, for example. And for videos, it's very attractive to present them with Facebook to the people. And Facebook is very cost effective to increase this pension awareness. So maybe it's not so effective for pensioners, because there we see that the pensioners have now a lower participation on Facebook and other social media, but especially like for people like my neighbors who are not looking in these mailboxes so often, these social media channels can be very effective in increasing pension awareness.
Thank you very much. So now the floor is open to Cosmin, please. Thank you.
Thank you so much. So it's I'm very happy that we have this great technology session, because I think often in the space of what we call essential services, we're not thinking much about technology, or we're usually putting technology as an afterthought. So I will be focusing a little bit on the process, on the challenges of designing these technologies for older adults. And thank you, Dariusz, for the introductions. And I'm not going to spend too much time reminding people that I am coming from a technology background, and we are focusing on designing technology. I lead a lab at the University of Toronto, Mississauga, which is focused on designing technology, improving user experience for older adults. And one of the focus of our research is looking at the challenges as we age from a design perspective, and often we are fighting a narrative that is pretty much stacked in a negative way against older adults. And we see that especially in the financial and healthcare domains, the demographic time bomb, the aging epidemic, it's very negative words used around aging, the consequences of our population getting older. And instead, this should actually be very good news that we now live in unprecedented times of more years for enjoyment with family, with friends. We can share our wisdom that we accumulated over the years. We can spend more time enjoying life in general, and the way we approach the design of digital systems to support that should match that. Instead, what happens is that often technology is leaving us behind instead of helping us, and that particularly affects older adults. And this is a focus of our research, and I will tell you a little bit about why that happens and how to address that. And one of the reasons is that our approach to designing this technology from a front-end perspective is often not helping older adults. And I'm using a metaphor that's a bit more common on this side of the Atlantic, of the Swiss knife, and trying to design the right tool for everything. And often what happens when we try to design such an appropriate tool, we end up with something that is way more than what people need, that is overwhelming in terms of design. And then we try to make it simpler and better. We often end up with a toy design that a lot of people would not find very useful. And specifically for older adults, if those of you who are familiar with or have family members or yourself are getting a certain age where you're more interested in designing for older adults and technology that would support you, you often find yourself looking at everything from the lens of overly simplistic design of technologies. And one of my favorite examples is this like big button calculators that often you can find in stores that are specifically targeting older adults. And unfortunately, it should not be all about this. And when it comes to design of digital technologies, these approaches that we currently have lead to older adults often just pushing back on technology and not wanting to adopt it. So a lot of our research is focused on understanding why this pushback happens, and especially for what we call essential services such as banking and healthcare. And one reason we found in our research, we conduct a lot of extensive ethnographic type research around design issues, and we all do our own designs as well. We found out that often designers ignore older adults when designing digital applications and services. We just finished a major survey with designers of technologies in essential services such as banking, and we found out that they do not consider older adults as an important market space. So they do not focus their designs on older adults. So we find significant attitudinal barriers for designers in engaging with seniors, but also practice barriers. They don't know how to design. At best, when they design for older adults, they look at this from the lens of aging-related impairments and the long list of things that have all scary medical names that affect us as we age. And unfortunately, we are focusing exclusively on these issues when we design for all adults. And that has particular consequences for essential services, such as banking. And in particular, as we want to transition from services that are in person to the digital versions of that. And that leads to the non-adoptions of many online services. And I will talk a little bit about the research we have done in understanding why seniors do not adopt, for example, online banking in Canada and online financial advising. We found out a significant distrust of these kind of service providers. And I'm very happy that Tom started the presentation with Robo advisors, because we looked at Robo advisors quite a lot, and we found very interesting adoption issues that are around issues of trust. And this leads to what we call as a term, digital marginalization. This introduction of services or migration of services to online that basically leaves seniors on the margins. They do not adopt this technology. They'd rather not use them than use them in the current online versions. And one of the problems that we found, and I talked a lot about this, is one of the actual problems that leads to these issues is what we call mental models. This is similar for those of you who work in behavioral economics. You're familiar with this term of mental models. It applies to what users know about the systems working. So for many of us, when we are faced with the new systems, it looks like something extremely complicated that we don't know how to use. And that leads to a significant push against its adoption. And ignoring these issues, or ignoring the fact that we prefer to do things in a certain way, leads to poor adoption of such services. And older adults have very, very strongly defined mental models. We finished a study last year on uploading pictures on social media. And we found significant mental models differences between young and old. We conducted a study with under 40s and over 60. And older adults had a completely different process of uploading pictures to social media. And they were heavy users of social media. And in fact, what we found out also is that the systems have been designed for young people to match young adults' mental models. So this significant mismatch led to a lot of errors, frustrations on the older user side. So where is this relevant? So applies to a wide range of seniors, and they are not necessarily casual users or clients. They can also be employees of companies. Like they are forced to use new software and services like this. But two areas where we focused a lot of our research was what we call engagement with essential services, digital and online services such as banking and healthcare, but also digitally mediated human-to-human communication, for example, advising, the kind of that Tom mentioned, but also extending to other services that are less necessarily financially essential, but socially important, such as social media. And Marike mentioned that a lot. We use that mostly for issues of loneliness and isolation that are very common in older houses. All are interrelated topics. So what are some of the consequences? I'm listing here findings from our research covering several projects where we engage with seniors around financial budgeting, as the use of digital tools for budgeting, use of digital online services to connect to banking. We have our own fake bank that we use as a prototype, and we have our own fake pharmacy that we use as a prototype to engage with seniors and test how they engage with such services. So we find several interesting things where the mental model mismatch led to several issues. One of the key ones we found is resistance to using such online services due to low trust. And this issue of trust is very interesting. It wasn't a matter of them not trusting the institution, especially when, for example, a financial service was already connected to something that they use. But it was an issue of trust in the competence of the system. For example, a question that they keep asking is, what if something goes wrong? The lack of physical presence was not reassuring if something goes wrong. And that was very important. They wanted to have this prior established trust with customer agents in everything they done. They wanted to have a personal financial advisor, and then they were very willing to move everything else online, but they wanted to start in person. So there was a strong preference for interacting with real people, even if it was mediated by technology. We found that in the healthcare domain as well, they were not reluctant to use online services. We tested a Robo advisor for healthcare. And actually people prefer that. One of our favorite quotes from that study was, "I don't have to put my pants on when I go see this doctor." They really, really liked having that, that online digital service, but they preferred it for very simple healthcare queries, such as, what's the good level of blood sugar, for example. So that very, very factual information. But for consultations, they wanted the person. They wanted a real person. And they did not mind it to be mediated by video, but it was very important to have an established relation with someone they already know, even if it was a physical person, but that person was away. It did not matter as long as they knew that person. So that creates a very interesting kind of design dimension. We also found that they are really not motivated from switching away from in-person transactions. This may be a very Canadian specific issue because the banking system in Canada and the financial system in Canada, as well as the healthcare one, are heavily protected, heavily insulated. So you can still get a bank at any time, anywhere in any village you live in. But there are also concerns with security. And it's not just financial security, but privacy security. They're all afraid of scammers chasing their information for both healthcare and financial, much more than younger adults. And they define these roles and social context for online services in a completely different way. And many of our participants who are sometimes in their mid-70s are heavy users of internet. So Canada has a very good reach for internet use among seniors. That they define it very, very, very clearly. They read the news a lot. So they're consumers of online services, but they don't engage the other way with online services. And there's some expectation for autonomy. There's a lot of concern over these tools taking over and not letting them in control. And that's a significant mental model. It's interesting that Marike mentioned that issue of the mailbox. And I have PhD students who are much younger nowadays, and they said, I have a mailbox. They don't even know that they have a mailbox at the university. They never checked it. And I made them check it, and 2 years after they first joined the university, it turns out that there's nothing in their mailbox anyway. So of course, because they don't get anything. So but that's a mental model. I check my mailbox every time I show up at the office. So it's an interesting mental model. And this leads to different uses of technology. So how can we fix things? So I'm going to very, very quickly mention how can we fix this. We follow several processes to address this. And it's very ethnographic. That's why it's a very difficult space, because it's very hard to get buy-in from, for example, banking industry. I presented this at all of the banks in Toronto, and it was very hard to get them on board with these processes. We usually get input as an advisory panel from seniors. We follow a method called contextual inquiry to understand how they do things currently. And then we spend time in a participatory design session with users. Only then we move on to designing a product. And the one I want to quickly mention, it's something that most people are not familiar with, is this method of contextual inquiry. We sit down with users and we ask them, teach me how you do something. So we have this role reversal. Teach me how you organize your picture. Teach me how to get a doctor's appointment. Teach me how to open a new bank account. And they will show you all the workarounds they do and what the problems are and what the sweet spot is in in workarounds and things they do that helps you see their mental models. And that's very intensive. Even if we do something like sessions with 10 participants, it's 2 to 4 hours each. It's very expensive in their homes. And it's a lot of data collected, videos, artifacts, notes. And only then we move to design recommendations. And that means participatory design. So designing not for users, but with users. And that's very traditional. Even for digital services, we do pen and paper. And we engage older adults in envisioning services for them. And we often found significant differences between how online platforms do things now and how they would expect these platforms to work for them. And this process is very powerful in finding out exactly how cultural background, social context, digital abilities all factor in having a bit of an ownership over the design process, and in general leads to better adoption of results. And we apply this to a variety of applications. There's no limit to where these processes can be used. And the important part is matching users' mental models with what the system delivers. And we apply this to social media, healthcare information platforms, learning how to use a new technology, online banking, online healthcare advising. And in all of these cases, we were successful in designing technology that seniors really, really adopted. And with that, I would like to thank you for your time. And if we do questions, I guess we'll move on to questions. I'm looking forward to seeing your questions.
Thank you very much, Cosmin. That was a very interesting, very rich presentation.